Good day to you. I want to speak to you about the Genzies, the Alpha generation. Those who are passing 15, 14, they are very combative. So whether you are a teacher or parent or a coach, do not engage them in combat. They are ready for a fight. They are always tuned up. They are very dopaminergic. The digital screen also drives them there. So my plea to you is that do not get into arguments with them. Do not use combative, belligerent words. If they start a fight, just sidestep it. You might be a pugilist, you might be a great boxer, you might be a very good teacher, but good teacher these days have to do with not only knowledge and content what to teach, but your attitude, how you handle this vital generation. They have great promise, but they also have great fight in them. There are many reasons why they feel like fighting. They feel time is short. They feel adults have wasted their world, and they feel much is consumed. They must become great by hook or by crook, quickly as possible. Then they will make tests for you, exam papers. They will ask you questions, even from father and mother, and they will see whether you can pass the test. You think you are expecting them to pass the test. They think you have to pass their test. So they will ask questions. They will do behavioral patterns to see how well you handle them. And if you by chance say, I will take a stick and hit you, they will say, here, so hit. So please don't get into that. Also, don't reprimand them, reminding them of their past error. That affirms the error. That drives them back into bottom-up regulation of risk, peril, fight, antipathy, dyspathy. Don't go that way. Somehow get them to be creative. Get them involved with their fingers in Lego, in puzzles, in board games, even playing cricket. A challenge course as we have in the den and dare of 374 Serpentine Road would be excellent. I am Dr. Lalith Mendis. I am the director of the Colombo Empathic Learning Center. We have to deal with many of these kids because their attention span has shortened, attention depth has shallowed, they are jittery in class. And sadly, doctors sometimes diagnose ADHD, attention deficit hyperactivity disorder, and start prescribing drugs like methylphenidate. Then they get more boisterous. Their appetite suffers. Their sleep patterns will suffer if they have not already suffered. So we have to get their appetite, good meal times, good sleep times, negotiate not to do digitizing late into the night, get them to do a good wake-up time. So there's much more. I'm Dr. Lalith Mendis. As I said, I have many clips on this. Please send a WhatsApp on 074-211-5011. They're just the tip of the iceberg. I am trying to get your attention. And about smartphones, 5 no's. Don't help them not to be too digitized after 6 p.m. because after 6 p.m. melatonin has to work. And then try to plead with them not to use too much LED lights around them, and help them to keep their meal time intact so that there will be a great meal, father and mother sitting together with them at least for the dinner time, and good conversation, oxytocin chats, and try to get their attention when they are falling asleep. 9:30, 10, it is GABA time. They feel empathy, they want to pour out their heart, the errors that happen during the day. That's the time to bond with them. So dad, be a champion. You can do this. Mom, you can do this. Thank you for listening.